The patient, Crystal Chambers, arrives at the Brian McMahon Hospital and waits patiently for the nurse to take her in a room where she will be examined by the
doctor. 20 years now, and my family's been telling me to go get checked up or whatever, blah blah blah. They told me to quit. I'm like, no, I don't want to quit. And so I'm gonna go to Dr. Bain's office to get this X-ray done right quick, and so they could just leave me alone, like, and get them off my back.
Mrs. Chambers? How are you doing today, ma'am? Good, thank you. Is this a regular checkup?
Yeah, I do this every few months or so. My kids insist I do that.
Okay. Have a seat right there. I'm gonna take your blood pressure and your heart rate and all that before you go see the doctor. Okay. It says here that you want an X-ray performed. May I ask why?
Yeah, my kids want me to do it. They check up on me, make sure I'm okay.
Okay. They sound like caring kids.
Nah, you can say that.
Okay, let me see this right here. Okay. So you say you're a smoker. May I ask how many packs of cigarette you smoke a day?
1, 2, 3.
How long have you been smoking? I mean, like, how long have you been experiencing this cough?
For a while now. I've been smoking for 20 years now, so and I just noticed this consistent like cough. You see it's coming up.
Okay, so what I'm gonna do is give you a list of symptoms, and you could just check up the symptoms that apply to you, and I'll be back soon, and I'll let you go in to see the doctor.
Okay, nurse.
All right. I'll be
Bye.
back.
Bye. Chest pain. Nah. Cough. Cough it up, blood. None of that. Fatigue. Sometimes. Weight loss. Lost of appetite. Nope. Shaving voice. Wheezing. Nah.
Hi, I'm back. Are you done?
Yeah, I'm all done.
All right. You said chest pain? No. Cough? Yes. Coughing up blood? No. Fatigue? Yes. Have you experienced any shortness of breath?
No.
All right. Let me make a note of that. You left one last one. Have you had any recurring lung problems such as bronchitis or pneumonia?
No.
All right. No and no. Okay. Well, I'll get everything ready for the doctor. You could go right in a minute.
Okay, thank you, girl. Thank you.
Mrs. Chambers' family continuously warns me that smoking can have serious health issues such as lung cancer. Ms. Chambers does not have many symptoms, therefore she does not believe she has the disease. However, lung cancer begins in stealth mode. There are usually no symptoms or warning signs in the early stages.
Ready? The doctor will see you now. Dr. Baines, your next patient, Mrs. Chambers. I'll be outside.
Hello, Mrs. Chambers.
Hey, Dr. Baines. How you doing? How's the family?
Well, the family is great. The grandchild on the way.
Oh, how exciting.
Very much so. My husband and I can't wait.
Oh, that's wonderful.
Yeah, so what brings you here today?
Well, my son insists that I get an X-ray because I've been having like this chronic cough, like, and he's like worried about me, so like.
You still smoke? Well, you might want to reconsider that. Because considering your age and how long you have been smoking, patients between the ages of 55 to 74, and those who have been smoking for more than 20 years can contract lung cancers. You are at a great risk, and your children are worried about you.
They don't need to be worried about me. It's my job to be worried about them.
I wouldn't want you to become ill, Miss Chambers. I will gladly schedule an x-ray and you should get some blood tests done. Are you free today?
Yeah, I'm free. We could do it.
You're in good hands, Miss Chamber. I will call the nurse. She can aid you. Miss Chambers is a chronic smoker, and she unfortunately, despite what her family tells her, won't quit. She needs to realize that lung cancer is very serious and are high rate among the African Americans. In fact, it is a leading cause of cancer-related deaths in African American men and women. She needs to quit or the results can be deadly. I have explained everything to the nurse. Once the results are in, the hospital will contact you so you can come in and we can discuss about the results.
Okay, thank you, doctor.
Are you ready?
Yeah, I'm ready. Let's go.
Where is it supposed to be?
Hold on, I gotta call my son real quick. I gotta tell him I'm running real late. So. Hold on. Boy, you know, I'm gonna be running late. No. Keep it together. I'm ready.
All right. Here we go. We're gonna go to the radiologist.
Okay.
She's waiting to see you. Once you're done with the x-ray, the radiologist will point you to the lab technician, and that's where you get your blood test done. The results should be in 2 weeks. Once you're done here, visit me by the desk, and I'll give you an appointment for next week, or 2 weeks. Does that sound good?
That's perfect.
All right, good. And see you.
Mrs. Chambers has her blood test and x-ray performed. When she's done, she returns to the nurse's desk in order to schedule her follow-up appointment.
Miss Chambers, I see that you're ready to go.
I'm ready.
Okay. Like I said, the results should take like 1 to 2 weeks, and we'll like give you an appointment for next week. Does next Friday, 9 a.m. sound good to you?
That's
All right. Let me make that.
I gotta go. I gotta cook some dinner.
Sounds good.
Chicken. And
Yes.
that rice.
All right. Friday at 9 a.m. Dr. Hayes. Take this with you and bring it next Friday when you come at 9 a.m. Nice to see you. Take care, Ms. Chambers.
Thank you.
You're welcome. Alright, thank you. Hi, Miss Chambers. You're early for your appointment. Okay. Miss Chambers, Dr. Hayes is ready to see you.
Hello, Dr. Bain.
Hello, Miss Chambers.
How are you?
Well, and yourself?
I'm good.
That's very good.
I hope my results are.
Oh, yes, they are, Miss Chambers. We are having some trouble identifying what the lumps on your lungs are.
What lump?
These lumps right here indicates a tumor growing, but we cannot conclude by the x-rays alone.
How the be like? This is crazy.
To be honest with you, Miss Chambers, you, like, considering your age and you're a chronic smoker, these two things are the factors of putting you into lung cancer.
Cancer? What? Cancer? Really? Really?
But like I said, we can't tell with the x-rays alone, so I haven't made arrangements with the oncologist. So we will work together and we will find what this lump is and we will start your treatment as soon as possible.
No cancer. Lung cancer! Oh my god!
Upon hearing the devastating news, the patient faints. Luckily, the incident occurred in a hospital, allowing Ms. Chambers to be treated right away. Because cancer cannot be diagnosed with a chest x-ray alone, Ms. Chambers is sent to an oncologist in order to have a CT scan performed. Due to abnormal results from the CT scan, a needle biopsy is performed in order to confirm whether or not there are cancer cells present in Mrs. Chambers' lung tissue. After performing the test, the medical technologist, Dr. Potus, analyzes the tissue sample and communicates the results to the oncologist.
Hi, Dr. Potus. Have a seat. Did you get the results of the biopsy?
Yes, I do, and unfortunately they do not look good. After I examined a sample of the patient's lung tissues under the microscope, I found that the cells of the tissue are unfortunately cancerous.
Oh, that's unfortunate.
Yes, it is. While looking at the cells, I saw that they were abnormally shaped. In fact, they were visibly distorted. The cells were all different in their sizes and shapes.
And how about the nucleus of the cells?
Well, as you can expect, the nucleus of the cancer cells were also shaped abnormally. After I stained the cells with certain dyes, it appeared darker than what is typically expected. Obviously, you know that this is because the nucleus contains too much DNA.
This is not good.
Yes, but there's some slightly good news. The tumor in the patient's lung is smaller than 5 centimeters in maximum diameter and has not spread to any other tissues or lymph nodes. Based on this information, I think it is safe to say that the patient only has stage 1 non-small lung cancer.
Alright, so I'll call my secretary and tell her to have Ms. Chambers come in so I can inform her about the results of her biopsy.
Okay, good luck.
Alright, thank you. Hi, Mrs. Chambers, how are you?
Very good, and yourself?
I'm fine. I have the results of your biopsy back, and I'm sorry to inform you that you have been diagnosed with stage 1 non-small lung cancer.
Really? I feared this would happen.
However, you know, the cancer is in the lungs and it hasn't metastasized yet. So, well, you know, since it's in its early stages and it hasn't spread to other parts of the body, it can be surgically removed.
Really? That's all? I thought it would be more difficult than that.
It's always difficult to tell a patient that they have cancer. You know, as you can imagine, this is the worst part of my job. I try to be as sensitive to my patients as possible because I understand how troubling the news can be. Localized lung cancer can be removed with just surgery. I recommend she gets a segmenectomy done to remove the portion of the cancerous tissue. This operation will allow her to be cancer-free and live a long, healthy life.
Alright, Ms. Chambers, so remember, the choice is yours. You can also choose to have radiation therapy, which is the use of x-rays to destroy cancer cells. And if you choose to do this treatment, it will be 5 days a week for several weeks.
Okay.
Alright, so, you know, take your time. I know this is a very difficult decision, but when you've made up your mind, you can call the hospital, the secretary will schedule an appointment with you, and you'll come back in and we'll just help you through this, okay?
Okay, thank you very much, doctor.
Alright, have a nice day.
I got surgery done about 2 months ago, and I've been feeling fine. No more chronic coughing, and the doctor said I will live a normal life. And but you know what?
survival rate of patients who are diagnosed at a low stage is also higher. In fact, the 5-year plus survival rate of stage 1 cancers is 75% when the cancer is either surgically removed or treated with radiation therapy. In order to avoid being in Ms. Chambers' situation, people should not or stop smoking. Also, eliminate exposure to tobacco and alcohol, clicking and smoking as best as possible. If you are lucky enough to have your lung cancer detected at an early stage and have it removed, you should not smoke because the cancer can be removed.
Dr. Nelson.
Oh, hi, Dr. Potus. I see. Did you get the results for the biopsy?
Obviously, you know that this is because the nucleus contains too much DNA. Yes, but there's. Why?
Let's go. So the doctor will finish. You're ready to go, Miss Chambers?
I'm ready to go.
That sounds fun. Okay. The results won't take long, like I said. Stop it.
In what's AA now? African.
African American. All of the lung tissues were indeed cancerous.
Oh, that's unfortunate. And
Yes, it is. While looking at the cells, as you can expect.
God,
Why you were smiling? What is wrong with y'all?
Does that sound good?
That's perfect.
Alright. Let's see.
Wait, Corley.
Why the fuck is that? I'm recording!
No, because it ends there. It ends there. You started.
Hello, Dr. B. How are you?
Well, I need to take
You gonna say
When
Oh,
you're
Lord.
coming in, was I
cancer? Lung cancer! Oh my god!
But like I said, we only can tell with the x-rays. So I have made arrangements for I cannot start
Really? That's all? I thought it would be more difficult than that.
there's something about you, girl.